This is Journeys to Growing the Good on Markets Plus, featuring intimate and inspiring conversations with visionary leaders where we uncover their unique personal stories, strategies, and passions that motivate them to boldly grow the good in business and life. I'm your host, Issam Majeed. Every day, families across Canada face a quiet but deeply personal challenge. They're not just navigating care, they're navigating uncertainty, not knowing when something is changing, what's normal, or when to act. Because while our healthcare system is built around visits, appointments, and interventions, health itself doesn't change on a schedule. It changes in between. And that gap, what happens between visits, is where risk builds, where problems are missed, and where families are often left on their own. Today's guest has spent his entire career building towards a different model. Robert Stanley is the CEO of Stay-at-Home Nursing Care and the founder of CHAH Technology, two organizations working at the intersection of healthcare delivery, workforce design, and a fundamentally different model of care. A model that asks a simple but powerful question. What if we could actually see what's happening at home and act on it before something goes wrong? Robert's journey isn't just about building a company. It's about challenging the structure of how care is delivered, how it's funded, and how we define success in healthcare. Robert, welcome to the show. Such a pleasure to have you.
Thank you so much for having me. It's great to be here. I appreciate it, Sam.
Now, Robert, you didn't start in healthcare. You came from more than 20 years in the technology world, including a long chapter in Singapore. When you entered this space, what did you see precisely? Because you weren't from here. You weren't, somebody who had an entire career in healthcare. You were coming in a little bit from the outside. Talk us through that.
It's interesting coming back as a Canadian after so many unexpected years away. It hadn't been planned that way, but it was great to get back home. And then to enter into a new industry, healthcare, was quite eye-opening, very rewarding. So being able to help people and see the impact you're having on individual lives was amazing for me. But the thing I think that stood out for me the most is that coming from technology, you're always looking for feedback loops. You're looking for how a system can learn from itself and improve. And I started looking for that in healthcare, and it's not really there, right? It's something where you mentioned that we do episodes and visits. This is how the healthcare system is set up, but it's not how healthcare works. Healthcare happens continuously. We get worse over time. We recover over time. And the system we have right now doesn't allow us to actually see into that, right? It's the PSWs and nurses, the doctors, the family physicians that have to kind of carry most of that in their head when they're dealing with a patient to try to remember, what has changed since the last time I saw this person. And that was a bit of a challenge for me. I think that's a big fundamental issue in the healthcare industry.
Now, Robert, we're going through this really fascinating, almost once in a century type of demographic shift as far as generations. And I've heard you discuss this before. Can you talk us through that? Because really, it is quite fascinating.
So the demographics that we're facing right now in Canada and much of the world comes from the baby boomer generations. All of the baby boomers will be over 65 by 2031. So we're moving into this area where a huge swath of our senior executives and workforce is retiring, and where the healthcare system is not necessarily geared to take them on. Right now in just Ontario, there's stats that we could look at across Canada, but every day we're seeing in the news the problems of ER wait times, the wait times for procedures, the people without primary care. The one that gets me the most is long-term care. So we have 80,000 long-term care beds today in Ontario, there's 72,000 people on the wait list for them. And that number, that wait list, which is already a terrible situation to be in, is going to get worse and worse every day between now and 2051. These are just the demographic math of how, the population is aging. In 2051, we hit peak 82-year-olds, and that's when the greatest demand for healthcare is going to be in our system. So we're already at a pretty fragile state, and the demand is going to keep increasing. So the thesis that we have here over at CHAH Technologies is we could disagree about exactly what we need to do, but we have to start from an agreement that we have to do something different than what we have been doing.
Robert, why do you think this doesn't get more play just in the broader public? I mean, I think all of us are, generally kind of aware of this to some extent, but why do you think this isn't more front of mind in media and just in the general public?
I think there's a couple of different elements to this. There's the human psychology of it, that we don't want to think about bad events, which is why we sometimes don't plan for insurance and life insurance and have those tough conversations. And so healthcare is deeply personal, but many of us don't necessarily plan for the worst as part of that. I do think we're getting good coverage. And the positive thing that I'm seeing right now with what we're doing here at, the vision, CHAH Technology stands for Comprehensive Healthcare at Home, the idea of moving more into the home from institution-based care. There's growing agreement on that. We tend to bury our heads in the sand a little bit as human beings, but I think there's growing awareness amongst decision makers that we have to do something different. And I'm starting to see some positive signs.
Yeah, I mean, we often hear about pressure on hospitals and funding gaps and staffing shortages. From where you sit, what's the underlying structural problem from your perspective in how healthcare is actually designed right now?
Coming from a technology background, I'm always thinking of systems and how systems work together. And the structure that we've built in Canada going back 60 years is a funding and billing system for visits. So that I go to an appointment, I bill for an appointment, I measure that appointment and say, I did good. In my world in home care, we've got somebody who's approved for a morning and evening visit, 2 hours a day, 22 hours a day, that this individual who's often living with chronic healthcare conditions, often living on their own, 22 hours where they're left to fend for themselves. But the system says, well, we did a good job. We gave 2 hours of care today and we delivered it successfully and it was fulfilled. But the reality is that healthcare, if you look at population health and the healthcare outcomes as your measure, you get much better results. We don't do that in Canada because we don't have the clear data to look at population health. And the system we've set up is to fund these visits. But you look at Germany, you look at Singapore, where I lived for many years, even Australia, which is very similar to us, is starting to make some significant shifts towards unified health records and the ability to now look at population health as your success metric. And that changes things dramatically when you say, how are people doing, and motivate with incentives that are successful if I'm keeping my population healthy. That's when you start to see a lot more preventative medicine coming in, which in Canada today, the system is designed around reactive. Very good when you end up in a hospital, high quality care, but nothing until you get to that point where you have to go to hospital. There's no preventative programs that are established.
Yeah, it's so interesting that you mentioned that, because one of the challenges in healthcare, as you note, is that success is often measured by what you actually do. So procedures, visits, interventions, but a lot of what you're focused on is what doesn't happen, right? Problems that are avoided. This actually touches a bit upon this whole idea of proactive versus reactionary care. And this has actually come up on some of our previous episodes. But how do you measure success in a system that isn't designed to measure prevention?
So I'll answer this in two ways. The first is looking at a system that I think is working in Germany. And Germany is structured around population health. So they have multiple providers of healthcare, all not for profit. German citizens can move between one or another. So there's a bit of pressure on who's doing the best and delivering the best quality care. And the insurers, there's a multitude of them, and they're competitive against each other. They get a certain budget based upon the overall health of their population, age and gender and chronic conditions that they might be dealing with. And they spend that as best they can to get the best results. And they attract more people into their insurance group if they do it successfully. So the whole thing that I've just described very briefly is designed around spending the money most effectively to get good outcomes for the people in the system. That becomes something that we can do if we have visibility into the total health of what people are living through. Very difficult to change the healthcare system. It's monolithic. It's huge with lots of different pieces in it. But we're doing at a macro level in the home, looking at an individual where with comprehensive healthcare at home, we're able to monitor 24/7. We look at changes in gait and how people are walking around. We look at changes in temperature on a day-to-day basis. So we have some biosensors. And with that, we can get predictive. So our system can predict up to 4 weeks in advance that somebody is at risk of a fall. So instead of waiting for the fall to happen and sending somebody to hospital and getting good quality care, we try to prevent the fall from happening in the first place. Your question was, how do we measure that? Well, we've just launched a pretty exciting new project with McMaster University to do an econometric study over the next 18 months. It just kicked off last month that will measure the reduction in unscheduled overnight hospital visits, of ER visits, of falls and infections by using our predictive technology versus the general population.
That's really fascinating. And what would that look like for, let's say, a customer? So let's say in their 40s, both busy working professionals, they've got elderly parents, they were interested in the service. They obviously busy lives, don't have time to visit their parents every day. Parents may not be needing to be in a facility full time, but they want that peace of mind and assurance. So what does that service actually look like?
I love that you're putting into stories. I think stories are very powerful things. The scenario you described is so common in today's world. And again, system design means that you need to have continuity of care. You need to have somebody watching over those sons and daughters that end up providing that care after hours, out of work, going to emergency rooms with their mom, and the system just expects them to do it. So there's a lot of statistics on the burden of unpaid caregiving within the Canadian healthcare system. And I like to put numbers on it. So we spend about $400 billion on healthcare in general. There's an estimate $97 billion impact to our economy for unpaid caregivers that are putting in extra work to take care of families. But on a very specific story level, yes, how does our service work in there? For somebody who's dealing with chronic care conditions, we would go in and bundle not just the 24/7 monitoring that comprehensive healthcare at home offers. So we put a system in place that monitors 24/7. We can detect various adverse events. So we can detect a fall. We can detect if a dementia patient who's living on their own is exiting, going out on a cold winter night when it could be risky for them. We can detect if there's an environmental risk like a stove left on that could result in a fire. And when we detect that, we can take action. This is a really unique thing about what we've put together, where I'm operating both a home care company, a traditional home care services company, as well as a technology company. Healthcare is always going to be human reliant. And the people delivering the care, what we're trying to build is something that will allow them to deliver the care much more efficiently. So when we detect a fall, we've got a team of human beings now, not AI, not technology, but human beings that are going to interpret, is this a very serious fall? Call 911 and have care out there within minutes in most places in Ontario. If it's a less serious fall, so we see this quite often in our population, somebody falls, they're on a carpet, they get back up, they're watching TV. We wouldn't burden the system with a 911 call and send paramedics out. We would send one of our staff, a personal support worker or a nurse, to get out there in the next 30 minutes or an hour. So we've determined that it's not an urgent rush, but we'll be there shortly and be able to do a head-to-toe check to make sure there's no bruises or cuts that we didn't see through the AI detection. So the bottom line for those sons and daughters that are taking care of mom or dad, we now have a 24/7 monitoring solution that will be able to intervene if something happens. And I think the more powerful aspect of what we're doing, I mentioned this earlier, is the prediction capability where instead of waiting for the fall to happen, we predict that there's a risk. And instead of sending out paramedics, we send out an occupational therapist to change how that person moves around their home. Maybe they start using a walker that they weren't using before. Maybe we install some grab bars. But the goal would be to prevent the fall before it actually occurs.
In home care, amongst many industries, the workforce in particular is everything. But clearly, it's also under enormous strain. Why does the system struggle to support the very people that it depends on to deliver this care?
Yeah, it's two sides of the same coin. So the 97 billion and the paid workforce are both essentially doing the same job, caring for individuals who need care and that we're obligated to care for, morally, but also legally under the Canada Health Act. And you've got paid caregivers, personal support workers for the most part, nurses, therapists that are coming in. And then you've got the unpaid caregivers. And when the system is failing to provide the care needed, the unpaid caregivers have to take on that burden. What happens within the healthcare system, I say this all the time to my team, we get what we design for. And we've designed a healthcare system right now that puts a substantial amount of burden both on the unpaid and the paid caregivers and just expects them to absorb it. Personal support workers are the backbone of our healthcare system. They're in every hospital, every long-term care, and they do the bulk of the home care work that I'm involved in. There's 200,000 across Canada. There was a study last year by CSA Group, interesting in a couple of effects, but it suggested that over half, 55% of those 200,000 caregivers are thinking of quitting. And the turnover rate, the ones with less than 1 year of experience, is more than a third. So maybe not all 55% are going to quit, but the turnover year by year is huge. The most interesting thing, though, is that 86% of them reported that they enjoyed the work they do. So square that circle for a moment, right? You've got people who like doing what they're doing because they care about people, they want to support, they feel rewarded when they're helping families get through these difficult times. They're on what's called casual time employment, which means that they might be getting 30 or 40 hours a week if they're lucky, but that's starting at 6 a.m, working till 10 p.m. at night, 6 or 7 days a week, where they're only getting paid for the shifts they go to. And when a client, which is unfortunately happening quite often in our industry, passes away or moves to long-term care, that employee might find their salary for that month dropping by half because they only get paid for what they do. So I think this is part of the problem that we've created for ourselves. I do think there's ways to get around it. So we're trying to address that again in a small level within our organization by giving people full-time employment. It's required for us to do the 24/7. We need to have people that are working around the clock. And so we've created a new model that we hope will be an inspiration for other organizations to improve the work quality for this very valuable resource.
You must have had over the years thousands of interactions with families and caregivers. I have to ask, is there one moment or story that really fundamentally changed how you think about what care should look like something that to this day stands out in your mind and drives you?
I remember this was several years back. We were helping a family where it was a very tight-knit family. They were very close. The mom, by all accounts, I only got to know her in her later years, by all accounts had just been an incredibly inspirational person with a wide variety of talents, but suffering, which is all too common from dementia, and the family all rallying around to support her. And when we went in and started helping, there was a phrase that stood out to me, and I always remember this. She said, Robert, when your team came in, we all had a responsibility to mom, but you've given us back a relationship. And if you really think about it, that is the most valuable thing that any of us can hope for or ask for, especially as we're getting close to end of life with somebody we love and care for, to be able to connect with them. And if we can give them back a little bit of that relationship, that's a job well done for me and my team.
Very well said. I couldn't agree more. And I mean, this is such emotionally demanding work, Robert. Like you're dealing with families at vulnerable moments. You're also trying to build something new. How do you stay personally grounded through all of that? I think a lot of leaders from lots of different businesses, industries face that challenge, but it's particularly relevant for you. I mean, how do you as a leader, how do you manage to stay grounded?
I find it so energizing to believe that when we look at these very fundamental problems in healthcare, to think that there is a broader solution out there. And I don't pretend that we're going to solve the healthcare system by any means at all. But if we can give a little bit of inspiration, give a little bit of relief, and show a different way of doing things, I think that will be an amazing accomplishment. You know,
I read a stat, and actually, I think it's one you may have spoken to as well previously. 96% of Canadians surveyed say they prefer receiving care at home. So, keeping that in mind, if we move forward, say 10 to 20 years, and we get this right, from your perspective, what does healthcare actually look like? And specifically, what changes when we can see what's happening at home in real time?
if we can get to the point where health is being continuously monitored in the home and we can work to prevent issues from arising before they become those critical moments, I think we'll see a health system that has much better healthcare outcomes, that maybe is not less than it is today, but it is definitely less as a percentage of GDP, but with better outcomes and the ability to deliver health anywhere that it's needed. If home becomes the primary place for healthcare, if we're able to do hospital at home, there's no reason why I can't have the same quality of care from my home in Pickle Lake, Ontario, as I would if I was down in downtown Toronto at Toronto General. That would be, to me, the ultimate goal. And I think it's possible.
Robert, you are a leader that's trying to scale two organizations and create an impact, a societal impact that benefits people's lives within a complex system or systems. There's a lot of other leaders who are trying to do the same thing. And it may not be in healthcare necessarily, it could be in other industries. But what advice would you give as a leader, as the CEO of stay-at-home nursing and CHAH technology about building something meaningful that has a societal purpose that benefits people's lives, scale a business without losing the human side of it? Because I'm sure there are moments where you feel like you have to make a trade-off to keep growing your business. You maybe have to sacrifice a little bit on your vision to scale with a purpose. What advice would you give other leaders?
It's always really important to remember both the people that are delivering the service, whatever it is you're doing, whether it's our home care or anything else, but the people that are getting it as well. And especially when you're looking at some radical change and looking at new ways of doing things, you have to ground yourself in the reality, the lived reality. In my industry, I still get out and visit clients in their homes. And I get to see what they're living in. I talk to our caregivers that are providing the care. And so I think keeping in touch with what you're delivering and why you're delivering it is going to be helpful no matter what you're building.
I think that's such a great point. And the fact that, as a CEO of two organizations, to be getting out and visiting clients personally in their own home, it's such a great example. And I'm sure it's something that a lot of leaders struggle given their time commitments, but certainly gives you such a fantastic perspective that you can't otherwise replicate through any other way. So that's great guidance. Thinking ahead for listeners, especially those that are thinking about care for themselves or for a loved one, where can they learn more or even start that conversation? I'm sure there's a lot of people who are thinking about this subject, but just don't even know where to begin.
I would encourage anybody who wants to learn a little bit more at Stay at Home Nursing, which is our home care organization, www.stayathomenursing.com. We're always glad to engage in a conversation. There's no charge for this. One of my nurses will sit down and talk about what the issues are that you're facing, what some of the options are. And we try to give good advice. For some people, staying at home just isn't the reasonable way to do it. And they should be looking at institutional long-term care or retirement home where it might be a bit better for them. But we try to take each of those conversations honestly and help guide the families and the individuals to the best course for them.
Now, you are at this really interesting inflection point. Your businesses you've been building, starting to scale, gaining broader attention. What are you most focused on over the next few years in particular for stay-at-home nursing and for CHAH technology?
I'm going to say Canada. And this has been an interesting part that might be interesting for your listeners that are doing startup. It still is a very difficult environment in Canada to raise capital, to get support, and in particular for healthcare, because our system is so monolithic and it's hard to get change, and the workforce is stressed, it's hard to bring technology in. And so we faced a lot of hurdles as we've taken an advanced 24/7 monitoring solution to market. And I've been encouraged by so many people in so many different capacities to go down and just sell to the US. So I'm very focused on getting our product successfully validated with things like the McMaster study that I talked about, getting hard data that we can present to people, and working progressively with our healthcare leadership in Ontario at Ontario Health and Ontario Health at Home, but across Canada, because I want this to be available for everybody. I love our Canadian healthcare system and I want to preserve that. And I think we need some relief valves for it if we're going to be able to preserve that for the next few years.
Very inspiring, Robert. And it's so true. We have so much fantastic innovation and technology and visionary leaders in this country, whether they're younger, whether they're older. And it doesn't even just have to be healthcare. It's many different industries. And, it's often the mindset of, well, we have to take this elsewhere to other markets to succeed. But we as Canadians should benefit from our own innovation and productivity and our resourcefulness and have the benefit of that. So very well said. This brings us to the final topic, and this is something that we pose to every guest on the show. Now, as you know, Robert, growing the good is our foundational theme on the show and the very purpose that we're driven by at BMO. How we engage with each other, our customers, and the communities we're so proud to be a part of every day. So with that said, Robert Stanley, what does growing the good mean to you?
Such a great podcast that you have and such a good question to end on. I think there's two measures for me. I think one is about the impact and benefit on our clients that are using this. If I can keep somebody out of hospital for a sepsis from an infection, that's obviously great for the system, but even more for the family. But I also think that because of my background in technology, that this has to be systemized, and we have to look at ways of looking to scale this beyond a small company in Southern Ontario. And so if we can inspire change in the healthcare system, if we can support the Pan-Canadian healthcare data strategy, which will unlock a lot more companies like ours to come out and provide care and support, and build a system in Canada that's worthy of what we expect, a small contribution there would also be something that I'll be very proud of.
Well, Robert, it's been such a pleasure chatting with you. Thank you so much for joining us today on Journeys to Growing the Good on Markets Plus. Thank you as well to our listeners. And until next time, I'm your host, Issam Majeed.
Thank you so much.
Thanks for listening. You can follow this podcast on Apple Podcasts, Spotify, or your favorite podcast app. For more episodes, visit bmocm.com/marketsplus.
The views expressed here are those of the participants and may not necessarily represent those of BMO Capital Markets, its affiliates, or subsidiaries.
For BMO disclosures, please visit bmocm.com/podcast/disclaimer.